My name is Dr. Joe Garland. I'm one of the physicians who regularly volunteers in the clinic here, here at Streetside. I'm also an infectious diseases doctor, and I wanted to talk to you today specifically about overdose prevention. It's one of the services offered here at Prevention Point, Philadelphia, and not a lot of other places. In my opinion, it's an incredibly important service to the community, and data have shown that people who have undergone overdose prevention training actually have a much, that the benefit of this training is actually a decrease in mortality and fatal overdoses. So this is an incredibly important service. This is a life-saving service for our clients. This is something that we can bring up in the routine visits. People can be coming in for colds or for medical assessment forms, or can be coming in with an abscess, and all of these are opportunities for us to address the issue of overdose prevention with patients, to ask them, is this something that they know about? Is this something that they have would like training in? It should be something that becomes part of our routine health assessment here, given the client population we take care of and the proven benefit of this intervention in the community. I'd like to emphasize that this is not something that you need to be a world expert on. Even if you are not an expert on substance abuse or anything, this is something that you can train patients on. It is not a difficult concept for you to understand. You don't have to feel like you're an expert. You can do this. The assessment for this is brief. You don't need to do a 20-minute assessment, but basically getting a sense of someone's drug use, and if they are at risk or if they are around people who are at risk, offering them this treatment. It can be added to any regular medical visit regardless of what people come in for. And the way to sort of think about this is just looking at the intake forms, looking at the screening forms. Sometimes patients will say, I'm interested in it. Sometimes as you're going through the history that the patients have written, or on their screening forms, or the history that you're taking from patients, there will be an indication that this patient is either around people who may be using regularly, or this patient may be using. And for either of those categories, someone you should think about offering training for. Overdose is a medical issue. It is an incredibly dangerous condition that is unfortunately often life-threatening and often, unfortunately, fatal. And so it's something that we have many ways of trying to prevent. A big one is to have the right drugs on hand when somebody needs them. So for this particular issue, it's naloxone. So if anybody's heard of naloxone, it's also called Narcan. It is an incredibly safe drug. It is an antagonist at the opioid receptor, mu-opioid receptor. So it basically unseats heroin from the receptor in your brain, allowing the patient immediately to sort of recover from an overdose. It is incredibly safe. It doesn't do anything else in the body. So if you give it to someone who hasn't overdosed, nothing really happens to them other than they got stuck in the arm or in the butt. But other than that, it's an incredibly safe intervention. Even if you make the wrong diagnosis and think that someone overdosed and they didn't, nothing bad's going to happen to the person other than they get a small shot. Let me, I guess, sort of take you through the kit here. So this is basically the kit that we give out. The training I can go through in a minute, but the kit's sort of important to have a little bit of familiarity with. So a couple things you'll see in here are syringes. These are 23 gauge syringes. Yeah, 23 gauge syringes, which are actually thick enough to go through most clothing, so you don't have to necessarily have the person take off their clothing to get access. So there'll be a packet of 23 gauge syringes. There'll also be some alcohol wipes. Ideally, patients will want to clean the area, please. I'm an infection doctor, please clean the area before you inject. And there'll be a bottle with 10 doses of naloxone. So it's 0.4 milligrams per milliliter, so you'll want to give 1 ml of this. The idea of how to do this is basically opening up the syringe. You want to pull back to 1 cc, and then you'll pop the top on the bottle. I don't want to waste the bottle, so I'm going to pretend on this part, but you'll pop the top to the bottle, plunge the syringe in, inject 1 cc of air, flip the bottle over, and draw back until you're at the 1 cc. So if you can see here, there's a nice 1 there. So you want to get about that much naloxone in the bottle, in your syringe, okay? If you see any air bubbles, it's great to push the air bubbles out while it's pointing up, so the air bubbles pop out the top. And when you see a little squirt of fluid, you're ready, okay? This can be injected anywhere where there's muscle, and so we recommend, so shoulder is a good place. You can also do it into the thigh, and the biggest place is on the buttocks, so the outer upper part of your butt. And so that's what we recommend to most people. Given this amount of fluid in the syringe, I strongly recommend upper outer buttocks because that's the most comfortable for patients. Again, remember this can go through clothing. So if you're not going through clothing and the patient and the person administering it has open skin in front of them, recommend taking an alcohol swab and quickly wiping down the area. Alcohol swab, quickly wiping down the area, and then basically plunging the syringe in and injecting. The response is pretty quick, so the person who's giving the injection should be aware that the victim may wake up pretty quickly. But an important thing to remember in this whole process is it only lasts maybe 30 minutes at max. We usually say about 15 to 30 minutes, and another important component is to make sure that people call 911 and to offer rescue breathing. All right, so those are that's what you sort of see in the packet. When you're training someone, I would say the first thing is to help people identify someone who is overdosed. A lot of people are already pretty familiar with this, but you want to differentiate between someone who is sleeping or nodding and someone who actually requires an intervention. Signs of overdose are often that people have either stopped breathing or have really slow, shallow breathing. You may notice that their fingers or lips are starting to turn blue. You may notice that when you try to yell at them or try to communicate with them, they're not responsive. We recommend shaking the patient or doing a sternal rub on them, shouting at them, trying to get them to wake up. If they don't, the first thing to do is certainly to call 911. And that's always what we tell people. Recommend rescue breathing and the administration of Narcan. Remember that the Narcan will wear off long before the heroin will, and so that calling 911 and keeping an eye on the patient are going to be key, because this only saves lives in the way that it keeps the patient alive and breathing until emergency services can arrive. And so the last thing I always tell people is if somebody wakes up, don't tell them not to use again until emergency services have arrived. So just to reiterate that process again, I would say the first thing is identify someone who is overdosed. Overdosed patients, shallow breathing, often lips or not breathing at all, lips and hands can be turning blue. Do not respond to shouting or attempts to awaken them. Call 911, rescue breathing, and then go ahead and administer the Narcan. Again, I went through the packet. It's pretty simple. That's all the training that you need to do with people, really. Certainly, anybody who's really interested, offer them other services. Our case managers are exceptionally well trained in this. They're happy to give more details to patients. But the most important thing is to get this life-saving drug out there. So don't feel like you don't have the skills to do this. You are an important way that we are providing a life-saving drug to the community.